So the next main topic in the inflammatory disorders of the heart after endocarditis and myocarditis, that is pericarditis. So as the name suggests, pericarditis. So itis refers to the inflammation and card it refers to the heart, and peri we know that pericardium, that is the outermost layer of the heart. So pericarditis refers to the inflammation of the pericardium of the heart. Okay, so we are already aware regarding the layers of the heart, isn't it? The pericardium, which is surrounding the heart. Okay, and that this pericardium, it is having an outer fibrous pericardium. Okay, it is having an outer fibrous pericardium which helps to keep the heart in the place in the chest, and there is also serous pericardium. Now serous pericardium is the inner layer. Okay, and that includes your pericardial cavity or pericardial sac. In this pericardial cavity or pericardial sac, there is some amount of pericardial fluid. Okay, so normally there is around 10 to 15 or 10 to 30 ml of this pericardial fluid. Now, most of the time, this pericardial fluid will prevent any sort of friction in between the layers. Okay, but in certain abnormal conditions, what happens? There can be excess accumulation of pericardial fluid also. And that condition will be called as pericardial effusion. Okay, we'll deal regarding it in this unit itself. Okay, so that is regarding the anatomy of the pericardium. Okay, remember about the inner serous layer and the outer fibrous pericardial layer. And already I have told about the functions of the pericardium. Okay, it provides lubrication and it prevents the friction. The definition of pericarditis, that is the inflammation of the pericardium or the pericardial sac. Now, what is the reason for the inflammation of the pericardium? Now, most of the time, the inflammation of the pericardium can be because of the inflammation of the other layers like endocardium or myocardium. Okay, so when there is inflammation of any other layer like endocardium or myocardium, like endocarditis is there or myocarditis is there, it may result in pericarditis also. And most of the time, it is seen that we are not knowing the exact reason for pericarditis. We don't know why the inflammation is occurring. Okay, in that case, we call it as idiopathic. And it is also seen that most of the time it is because of infections. Okay, like microorganisms, it could be your bacteria, virus, fungi, or even parasites. These all microorganisms can infect and can result in swelling or inflammation of the pericardium. Commonly, it is seen that viruses like your adenovirus or Epstein-Barr virus or HIV, mumps virus, all these viruses, not only that Candida, that is a fungi, then bacteria like Staphylococcus or Pneumococci, these also can result in the infection. And most commonly, it is seen that the people who have got any sort of cancers, okay, or they have got any neoplasms or tumors, these people are at high risk of developing pericarditis. For example, your people with leukemia or breast cancer or any other metastatic cancer, these people can get pericarditis. Next is because of exposure to radiation therapy or chemotherapy. In that case also, it may result in inflammation of the pericardium. Okay, and next is it is seen that certain drugs, if a person is taking certain drugs like anti-tubercular drugs, TB drugs we tell, no, that is like isoniazid. The spelling of isoniazid is wrong there in the slide. Okay, then anticonvulsants like phenytoin or some antibiotics like penicillin, these usually can result in inflammation of the pericardium. Next etiology or risk factor is, it is seen that individuals who have got metabolic disorders or individuals who have got some kidney damage. Okay, what happens in kidney damage is there is a excess accumulation of waste products, that is nitrogenous waste products will be accumulated, and it can result in uremia. Okay, that is excess waste products will be accumulated in the blood and it can cause uremia. All these conditions also can aggravate pericarditis, or if a person is having hypothyroidism, that also. And most of the time it is seen that autoimmunity, that is your immune system attacks one's own pericardium, and that itself, autoimmunity conditions, you know which are the different autoimmune conditions, isn't it? Like your rheumatoid arthritis, systemic lupus erythematosus, scleroderma. During all these conditions, because of the autoimmunity, it can also result in inflammation of the pericardium. Other than that, injury to the heart. Okay, for example, now injury to the heart can be most of the time during the time of any surgeries, okay, cardiac surgeries, or even because of any injury or trauma or accidents, or even after myocardial infarctions. So most of the time what happens is the heart cells will die and there can be inflammation of the pericardium. Okay, so this is the inflammation of the pericardium after the chest injury. Okay, you can see here there is inflammation of the pericardium. Some other etiologies are also there, that is aortic dissection. Okay, that is most of the time in the cases of aneurysms. Okay, we'll discuss in aneurysms. Next is late pericarditis. This is actually a complication that is seen in MI, myocardial infarction. So that is referred as Dressler's syndrome. Okay, so most of the patients after the myocardial infarction or after the heart attack, they can develop late pericarditis where there is inflammation or swelling of the pericardium. That is also one of the major risk factors. Other than that, we have got conditions like rheumatic heart disease as well as a rheumatic fever, which we'll be discussing in the coming classes. So these conditions also can result in pericarditis, okay, RHD and rheumatic fever. And patients who are with tuberculosis, these patients also can develop pericarditis. Next, we will move on to the types of pericarditis. We have got so many types of pericarditis, okay, based on the different type of classifications, like acute, subacute and chronic pericarditis. Now acute means it develops suddenly, okay, suddenly or quickly it develops, that is why it is called as acute pericarditis. Next is subacute pericarditis. It will develop within week or months. Next is chronic. It takes lot of time to develop. Okay, it may take around months or years also to develop. So it is called as chronic pericarditis. The next classification is infectious and non-infectious pericarditis. Now, infectious pericarditis most of the time is because of infection by microorganisms, like because of bacteria or virus. Non-infectious pericarditis is not because of the microorganism, some other causes, maybe drugs, or maybe because of autoimmunity or uremia. Okay, all that are non-infectious causes. There is one more classification, that is serous pericarditis, purulent, fibrinous pericarditis, calcific pericarditis and sanguineous pericarditis. So this is based on the content of the substance or the things that is present in the pericardial fluid. Okay, so serous pericarditis means serum is present in it. Purulent pericarditis means in the pericardial fluid there will be pus also. Okay, that time we call it as purulent pericarditis. Fibrinous pericarditis means there is presence of clotting proteins in it. Calcific pericarditis means some calcium deposits will be present in the pericardial fluid. And sanguineous pericarditis means some blood content will be there in it. Okay, then there is one more type, that is recurrent. Now most of the time what happens is pericarditis is quite recurrent, it will repeat, okay, again and again. So that is why that is one more classification. One more, we cannot tell it as types, but they are also referred as complications of pericarditis. Okay, that is pericardial effusion and cardiac tamponade. Both are almost the same. Okay, I'll tell you what is the difference here. Now, pericardial effusion, you might have heard the term pleural effusion. Okay, pleural effusion was excess accumulation of fluid in the pleural cavity. Okay, this is different. Pericardial effusion means excess accumulation of fluid in the pericardial sac or in the pericardial cavity. Okay, normally around 30 ml is quite normal, but your excess will be accumulated. That is called as pericardial effusion. Okay, more and more fluid will be accumulated in the pericardial sac. Now, what happens particularly when excess amount of fluid will accumulate in the pericardial sac is it will affect the contraction and relaxation of the heart. Okay, the heart will not be able to fill well. Filling will not be proper, or we can tell contraction and relaxation will not be normal. What happens because of that? It will result in low cardiac output. Okay, ultimately it may result in hypotension and shock and death. Okay, now when there is excess of pericardial effusion and it is affecting the heart's ability to pump the blood, and there is low cardiac output, that time we call it as cardiac tamponade. Remember that. Okay, so cardiac tamponade means nothing but excess accumulation of fluid is affecting the ability of the heart to pump the blood. Okay, that will lead in decreased cardiac output and shock and death. Next, one more type is constrictive pericarditis. Now, constrictive pericarditis is a bit rare, okay? And as the name suggests here, constrictive pericarditis means here the pericardium will undergo lot of thickening and stiffening. Okay, there is excess of thickening and stiffening. Okay, that is like fibrosis will develop in the pericardium. Okay, fibrosis or fibrotic thickening will be there in the pericardium. That is called as constrictive pericarditis. Now, in constrictive pericarditis, what happens is the the heart ventricle will not be able to pump the blood. Okay, because of the stiffening and thickening, the heart's ventricle will not be able to fill. So that will result in decreased stroke volume and cardiac output. That is called as constrictive pericarditis. Remember, constrictive here means there is thickening, stiffening and fibrotic thickening of the pericardium. Now, what are the clinical manifestations in pericarditis? We know all the disease conditions of the cardiac system. Here they will have chest pain. So here also most of the time person will develop chest pain. Okay, but here the person will have pleuritic type of chest pain. That is usually what happens here. The person's chest pain will be worsened or pain will be increased during inspiration. When they are inspiration, that is when they are taking in air, the chest pain will increase, and usually it will reduce, the chest pain will reduce if they sit or if they are leaning forward. Okay, and other than chest pain, patient can also have dyspnea like symptoms. Okay, breathing difficulty or shortness of breath is very common, and patient can have giddiness or fainting episodes. Diminished heart sounds can be there. Okay, lot of changes in the ECG and other things. We'll discuss it later. Along with that, because of the infection, patient can also develop with fever. Okay, patient will have fever, and other than that there is an abnormal heart sound that is heard. What happens is whenever excess of fluid is accumulating in the pericardial sac, an abnormal heart sound is heard, which is called as pericardial friction rub, like scratching or grating of leather substances sound we hear. No, similarly a high pitched sound will be heard, that is called pericardial friction rub. Okay, so this is just a figure of pericarditis. Next is moving on to pathophysiology. So due to etiological factors, what happens is because of the infectious conditions or drugs or because of uremia and all, there is inflammatory response. Okay, whenever there is inflammatory response or inflammation, we know what is released. There will be release of certain mediators. There is release of neutrophils and other chemical mediators. So when these chemical mediators are released, there is change in the permeability. Okay, and further what will happen? There will be inflammation of the pericardium or edema of the pericardium. What happens when there is edema or swelling of the pericardium? Obviously, there will be no proper contraction and relaxation of the heart. Okay, and patient will develop with chest pain and breathing problems. Okay, and further it will result in decreased cardiac output, or it may also result in heart failure. Okay, so this was regarding the pathophysiology. How to diagnose pericarditis? Now, first of all, we need to collect a thorough history from the patient to know if they have got any other disease conditions. Okay, and perform a thorough physical examination of the patient, and also auscultate for the abnormal heart sound, that is your pericardial friction rub. Okay, when you're auscultating, you can hear the grating type of sound. In ECG, it is seen that patient's ECG will be changed. Some patients can have ST segment elevation or PR segment depression can be there. Okay, and the chest X-ray will also show that there is a water bottle like sign. Okay, so here you can see here in the figure. Okay, so that is a peculiar water bottle like sign. Next, echocardiogram also it can is easily visible. You can see that there is excess accumulation of the fluid in the echocardiogram. Echocardiogram is nothing but you are doing the ultrasound of the heart. Other than that, computed tomography, magnetic resonance imaging can be performed. Laboratory investigations like blood investigations can be done, like your ESR, WBC count, all will be high. Even your C-reactive protein will remain high. Then next is we can perform the biopsy, okay, removing a small tissue from the pericardium, or you can also perform pericardiosynthesis. Now pericardiosynthesis is also a management and also a diagnostic procedure, okay. You're removing some fluid and you're sending it for the test, okay. So that is pericardiosynthesis. We'll discuss in detail in management. Okay, so pericardiosynthesis is particularly, it is done under sterile technique and it is done under echocardiogram guidance. Under echo guidance it is usually done. A needle will be inserted and you're removing the excess of pericardial fluid that is present. Now, what is the management of pericarditis? First of all, we should know what is the cause. Okay, so decide or think about the cause and treat the cause. For example, if it is because of infection, we need to give antibiotics or anti-fungals or antivirals. Okay, and then to reduce the pain, we may need to give non-steroidal anti-inflammatory drugs, corticosteroids, analgesics, and all have to be given, mainly because patient will have chest pain. Okay, so remember, other than this antibiotics, in order to reduce the infection, we also give aspirin also, okay, and some NSAIDs like ibuprofen and corticosteroids like prednisone or hydrocortisone can be given. Now, when there is excess amount of pericardial fluid, okay, in the pericardial sac, we have to perform pericardiosynthesis, okay. So, pericardiosynthesis, as I have told, it is a procedure in which we are, it is a therapeutic procedure also, it is a diagnostic procedure also, where you are removing the fluid, pericardial fluid from the pericardial sac. Normally, we know how much amount of fluid is there, around 15 ml to 30 ml of fluid is there. So here what happens is, even when you remove around 10 ml of fluid, the stroke volume will improve. Immediately the stroke volume and cardiac output will increase. Okay. So remember, in the case of pericarditis, you have to perform pericardiosynthesis. That is removing the excess of pericardial fluid. And as I told, it is performed under echocardiogram guidance. Okay, because you should know where you are inserting the needle, how much fluid has removed, that all you need to know. So that is why it is performed under echocardiogram guidance. So here you can see echocardiogram is also performed and they are also performing pericardiosynthesis. Okay, that is removing the excess of fluid. Before performing pericardiosynthesis, what you have to do is ECG has to be taken, echocardiogram has to be taken, and if the patient is on anticoagulants like aspirin or any blood thinners, you will have to withhold or stop those anticoagulants and continuously monitor the vital signs before the procedure as well as during and after the procedure, and monitor the person's bleeding time, clotting time, prothrombin time, as well as international normalized ratio, that is INR. During the procedure, what we have to do is make the patient to sit or lie in a supine position. Slightly you can elevate the head end and identify the xiphoid process, okay, and the fifth to sixth intercostal space. What you can do is, the site of insertion is usually in the left sternocostal margin, okay. So commonly we insert it in the fifth to sixth intercostal space, okay. That much you have to remember. And after the procedure, what we have to do is, most of the time we need to continuously monitor the vital signs, check for any leakage, bleeding. Okay, and again you can perform echocardiogram and find out how much amount of fluid is left behind. And after the procedure, you need to monitor for risk and complications, like your arrhythmias can develop, irregular heart rate and heart rhythm, or heart attack, or there can be injury to any nearby structures, like puncturing of coronary artery can occur, or there can be pneumothorax or hemothorax or laceration of heart muscle. That and all has to be checked after pericardiocentesis. Next, one more management is there, that is one more small surgical management, that is pericardectomy. You know what is ectomy? Ectomy means removal. Okay, so here they are doing the stripping of the pericardial layer. Okay, and most of the time you should remember that when they will do this pericardial stripping is when the person is having cardiac tamponade. Okay, and if the person is having constrictive pericarditis, that where there is complete stiffening, swelling of the pericardial layer, in that case we have to do pericardial stripping, that is resection or removal of the pericardium. So this is the surgical procedure that we do. Okay, next, what are the complications that is usually happening because of this pericarditis? Pericarditis complications include pericardial effusion, cardiac tamponade, and constrictive pericarditis. Okay, so about pericardial effusion, already I have discussed. What is that? Accumulation of pericardial fluid in the pericardial sac. Okay, it can occur slowly also or suddenly also. Okay, and commonly the patient will have signs and symptoms like shortness of breath and dyspnea or cough. Okay, so this commonly is seen in pericardial effusion. Okay, so pericardial effusion itself, when there is excess accumulation of pericardial fluid, it can develop or it can result in cardiac tamponade. That is, it will affect the contraction and relaxation of the heart. Okay, why it is affecting? Because some fluid is accumulated in the pericardial sac, so the heart will not be able to pump well. Okay, so that is why what happens, all the other complications can develop. Okay, that is like cardiac tamponade. So when there is excess accumulation of pericardial effusion, the heart may not be able to pump the blood. Okay, and that may result in, or that may affect the heart's ability to pump. Okay, that will affect the cardiac output and stroke volume. So there will be decreased cardiac output, decreased stroke volume. So that can result in cardiac tamponade. Okay. So here also the patient can have signs and symptoms like chest pain, anxiety, confusion, restlessness. Person will be very restless and irritable. Okay, in case of cardiac tamponade. The next complication, as I have told, is constrictive pericarditis. Already I have mentioned about this also. So here what happens is, as a complication, the pericardium becomes excessively stiffened. Okay, it will result in fibrotic thickening. There will be scarring. Okay, and that may affect the ventricular filling. It will affect the ventricular filling. So because of that, what will happen? There is decreased cardiac output, decreased stroke volume. Okay, and furthermore, it is seen that pericarditis not only results in cardiac tamponade or constrictive pericarditis, it may further result in heart failure. Okay, so that is also one more major complication: heart failure, cor pulmonale, where there is right-sided heart failure, and distension of the jugular vein. Some other management is also there for this pericarditis. Okay, that is most of the time what we do is we have to give diuretics to the patient. Okay, so now diuretics, we know why we give, because whenever there is fluid retention, commonly we need to give diuretics like your Lasix. Okay, and patient can have heart failure also, so to treat that also diuretics are given. Positive inotropic drugs like dopamine can be given to the patient, especially when the person is having shock or in hypotension. And again, if the person is having symptoms of heart failure, it is better to restrict the fluids and also reducing the salt in the diet and monitoring the intake output chart frequently. And in order to reduce the inflammation, we can give drugs like colchicine to the patient. Next is regarding the nursing management. We know assessment, then we have to write nursing diagnosis and intervention. So when we are assessing, you have to assess for the type of chest pain, the quality of chest pain, okay? And what are the aggravating factors or relieving factors of chest pain, that also has to be assessed. Along with that, you have to monitor the ECG or check the echo of the patient. and see for the pain relief measures. Okay, provide some comfortable devices, change the position of the patient, maybe slightly semi-flawless position can be given to the patient. Next is moving on to nursing diagnosis. You can frame lot of different nursing diagnosis for pericarditis, like chest pain related to the inflammation of the pericardium. Okay, or you can also write ineffective breathing pattern related to the inflammation of pericardium, or activity intolerance related to chest pain. Okay, all these nursing diagnosis can be written. Then there is one mnemonic. Okay, you know what are mnemonics? Usually the first letters we will frame together and we will make a word, so you can remember the etiology or any other things quite well. Okay, so here we have got a mnemonic cardiac, CARDIAC. C means any collagen disorders, aortic aneurysm, radiation, drugs, infections, acute renal failure, and cardiac or heart infarction, or that is myocardial infarction. Okay, so remember this term. Okay, cardiac. Next, there is one more mnemonic in order to remember, that is used for cardiac tamponade, okay, or pericarditis. Now, cardiac tamponade classical symptom is as Beck's triad. It can be asked by the examiners. Beck's triad means person will have jugular vein distension. There is hypotension in the patient. Okay, patient will be having hypotension, and along with that the person can also have pain in the chest. Okay, there can be pain in the chest. Okay, so that is particularly referred as Beck's triad.